Okay, hold on. I think it's recording. All right, let me mute myself and then you can go whenever you want.
Okay. How many of you have struggled with anxiety or depression? Anxiety and depression disorders are the most common mental illnesses in the United States, affecting up to 40 million adults. These specific mental illnesses often coexist together as one can easily trigger the other. The fight against anxiety and depression is not addressed enough. We need to spread awareness in order to help others know that they are not alone. Today, I will first talk about what anxiety is and the different types that people may experience. Second, I will explain what depression is and hopefully give you a better perspective on how hard it really is to live with depression on a daily basis. Finally, I will talk about the different kinds of treatments for anxiety and depression as they are very similar. According to Medline Plus, the article says anxiety is a feeling of fear, dread, and uneasiness. Symptoms of anxiety include sweating, the feeling of being restless or tense, and having a rapid heartbeat. These symptoms can also be a normal reaction to stress, like, for example, feeling anxious while taking a test. However, anxiety disorders are conditions in which anxiety does not go away and actually tends to get worse over time. Constant anxiety gets overwhelming for most people who are suffering from it. The Anxiety and Depression Association of America says anxiety disorders develop from a complex set of risk factors, including genetics, brain chemistry, personality, and life events. Anxiety disorders can interfere with daily activities, including schoolwork, job performance, and relationships. There are various types of anxiety disorders. The most common anxiety disorders are generalized anxiety, panic disorder, and phobias. Generalized anxiety disorder is described as an excessive worrying about day-to-day issues such as health, work, money, and family. A person with generalized anxiety will have these fears every day for at least 6 months. Panic disorder is described as having panic attacks, which are sudden and frequent periods of feeling intense fear when there is no reason to. These panic attacks appear quickly and can last up to 2 minutes or more. Lastly, phobias are described as having an extreme fear of something that presents little to no danger. Some common phobias are having a fear of spiders, large crowds, flying, or being in social environments, which is known as social anxiety. Medline Plus says the risk factors for the different types of anxiety disorders can vary. For example, GAD and phobias are more common in women, but social anxiety affects men and women equally. Social and environmental risk factors for anxiety disorders include a person's personality traits like being shy when in new situations or meeting new people. Traumatic events during childhood and even adulthood could also lead to anxiety disorders. In addition to anxiety disorders, another common mental illness is depression. The American Psychiatric Association defines depression as a common and serious medical illness that affects how you feel, the way you think, and how you act. Depression causes feelings of sadness and/or loss of interest in activities you once enjoyed. Depression is a disorder of the brain. The causes of depression are very similar to the causes of anxiety disorders. Causes of depression include genetic, biological, environmental, and psychological factors. Depression is most common in women and can be developed at any age. However, depression usually begins in teens and young adults. There are many symptoms of depression. Some symptoms include feeling sad or empty, loss of interest in activities, overeating or not eating enough, not being able to sleep, hopelessness, guilt, anxiousness, or irritability. Also, maybe digestive problems. The scariest symptom is thoughts of death or suicide. There are also various depression disorders, which include bipolar disorder, postpartum, clinical depression, and persistent depressive disorder. Living with depression can be overwhelming at times. I found an article that may give you a better perspective on what living with depression is like for some people. Medical News Today says depression is a real mental illness. Those who have depression cannot simply decide to stop feeling depressed. Unlike typical sadness or worry, depression feels all-consuming and hopeless. The article also gives a list of what it feels like to live with depression. People living with it may feel like there's no pleasure or joy in life. Everything feels hopeless to them. It is also harder to concentrate as you are unable to think clearly and make any kind of decisions. Also, self-esteem is most likely absent in a person living with depression. They often have feelings of worthlessness and being a failure. Depression can last months and even up to years. People suffering from it often have difficulty with careers, relationships, and daily tasks, such as self-care or housework. Although anxiety and depression can be scary, there are treatments and things that you can do to get better. Research shows that exercise can make a huge difference for people with anxiety or depression. Mayo Clinic says the links between depression, anxiety, and exercise aren't entirely clear, but working out and other forms of physical activity can definitely ease symptoms of depression or anxiety and make you feel better. Exercise may also help keep depression and anxiety from coming back once you're feeling better. Other ways that exercise helps to improve symptoms of anxiety and depression are taking your mind off of worries, helping to gain confidence back, and to cope in a healthy way. In addition to exercise, therapy is also a great treatment to overcome anxiety and depression. One type of treatment is therapy, and it may be helpful. It is called cognitive behavioral therapy. The Anxiety and Depression Association of America says it focuses on identifying, understanding, and changing thinking and behavior patterns. Benefits are usually seen in 12 to 16 weeks. In cognitive behavioral therapy, the patient is actively involved in his or her own recovery, has a sense of self-control, and learns skills that are useful throughout life. Another option for treating anxiety and depression is medication. Using medication is generally safe and an effective way of treatment that is often used simultaneously with therapy. The Anxiety and Depression Association of America says medication may be a short-term or long-term treatment option depending on severity of symptoms, other medical conditions, and other individual circumstances. However, it often takes time and patience to find the drug that works best for you. In conclusion, I first talked about what anxiety is, the symptoms, risk factors, and some of the different disorder types. Second, I talked about what depression is defined as, the risk factors, and what it feels like to live with anxiety. Finally, I talked about the different treatment options for anxiety and depression. The fight against anxiety and depression is real. These issues need to be addressed in order for others to get help and know that they are not alone. During times like COVID-19, it is important to spread awareness to people who are struggling with their mental health. I hope that this information will help you or a loved one who is struggling with anxiety or depression. Anxiety and depression disorders are more common than we think, but getting help can have a huge impact on your overall well-being. Thank you for listening.